Well, the difference is that sadness is a normal human emotion, much like anger or anxiety and so forth, and people from time to time can feel sad. There's nothing wrong with that. It's lost sometimes for hours, sometimes for days, but eventually you do get over that. Depression is quite different. Depression, we talk about clinical depression, it's an actual illness. It lasts for much longer, it's much more profound, and it needs, requires some form of management. Well, depression, first of all, is a sadness or feeling low, feeling down, which lasts for at least 2 weeks. And usually it's accompanied with some form of functional impairment, so people aren't performing as well in their work, at home they have issues and so forth. So that usually in some area in their life they're not doing that well. Together with that, there are psychological symptoms and physical symptoms. Some of the common physical symptoms we may see are disturbances in sleep, disturbances in appetite, sometimes in sexual libido and so forth. The psychological symptoms, often people lose motivation, they can lose joy, so in other words they don't enjoy the same things they used to enjoy before they became depressed. They feel hopeless, helpless, and sometimes even suicidal ideation, so they actually start to think about ending it all. Often become quite self-critical and their self-esteem drops. First of all, some people are simply prone to it because they've got a family history of depression, so it's more genetic. Or they have a type of personality which is more prone to depression, like perfectionistic personality or an anxious, worrying personality, so those people are more likely to get depression. And then there are things in their past history which may lead to depression later on. So for example, past traumas, abuse in the past, neglect and so forth. On the other hand, there may be things that are happening now, and often those things are related to chronic stresses in a person's life. So it may be simply their work, or it may be that they become retrenched or a lack of work, or they can't find work. It may be related to relationships or relationship breakdowns, so forth, or a loss, relationship loss. And then it may be health. Another health issue, for example, diabetes is closely associated with depression, so chronic pain. So a loss of their normal health or well-being in some way or another. Now, some people are more resilient than others to those chronic stresses, so in other words, some people put up with stress better than others, but at the end of the day, anyone facing stress out there will eventually land up with some effects from that, and that may be depression. But not all depression has to be treated with medication. First of all, there's psychological therapies, so talking therapies. Commonly we use CBT, which is cognitive behavioral therapy, and that has two components. There's the cognitive part where we challenge people's thinking and try and help them to come up with more realistic and helpful thinking, because often they think is quite negative in depression. And then there's the behavioural part of that, where we give behavioural tasks to do. For example, with depression, often people become isolated. So one of the things we like to do is get people out there, back into their normal society, back into socialising with people, back to their workplace and so forth. Often people have stopped doing physical exercise, so we like to get them back into doing the kind of exercise they like doing, and that also helps them feel better and produces a whole lot of good feel-good hormones and so forth. So there's a lot of behaviours that people can do, and we find that when people start to behave in the way they used to behave before they became depressed, it actually starts to get them out of depression. A newer form of CBT is called ACT, Acceptance and Commitment Therapy, and that's what we tend to use a lot of here in this practice, which is not so much about changing thinking as much as simply recognizing unhelpful thinking and being able to differentiate between that and helpful thinking and simply let go of that unhelpful thinking. So we don't have to change anything as long as you can recognize it's not helpful. It's sort of like being at a railway station. There are lots of trains go by, like lots of thoughts may come into your head, but you don't have to get on every train. If the train's not going in your direction, you don't have to hop on it. Whereas if it is going your way, get on it, and it's similar to thoughts. So there are a lot of psychological therapies. They may not always be effective, and at some point one may need to introduce medication. Again, sometimes we'll introduce medication earlier depending on the severity of the depression. So when people are severely depressed where they can't even engage with those psychological therapies, they may need medication just to pick them up a little bit. They may also need medication if it's been recurrent depression, or if they found that in the past psychological therapies haven't helped and medication has, we might introduce medication sooner rather than later. Well, their lifestyle changes first of all. So for example, getting back out there, getting into the real world and doing things like just taking walks or going back to doing exercise, going back to do the things they used to enjoy that they often stop doing because of that lack of motivation and depression. So going out and watching a good movie, socializing with people, going out for a cup of coffee with a friend and so forth. Getting that social support that people are often lacking with depression. So really trying to do, and if there's an obvious trigger for the depression, they're looking at getting back into the workforce and doing something useful with their life so that they can find meaning and purpose rather than sitting at home each day simply brooding with the depression. So finding some purpose in your life where you've got a reason to get up and get out the house and go and do something that makes you feel good is an important part of managing depression in the long term. Other than that, there are groups that people can join, support groups and so forth, that allow them to understand that they're not the only one going through that. Other people are going through those same issues and they can get strength from those groups. Another thing that I feel is very important is nutrition. So to stop eating junk food that's been associated with depression and to look at eating well, going to the supermarket, buying good food, eating well, and cutting down as much as possible on alcohol. There's alcohol, a big issue with depression. It's often a comorbidity with depression. We're never sure where it started, whether it's the alcohol that then caused the depression because alcohol in itself is depressogenic, or whether it's depression that made a person drink more because they're self-medicating. Either which way, once it becomes depression with heavy drinking, it's much harder to treat, and so cutting down on alcohol is really important. So those are some of the lifestyle changes that are important. And outside that, I particularly like other skills such as yoga and meditation. I feel those two are very useful, and I teach patients sort of my own way of doing that, that really allow them to sort of become more psychologically aware of some of those thoughts and feelings that can drag them into depression and become more resilient to them.